Today I can confirm that there are no new cases of COVID-19 in New Zealand, and there are no new old cases either. That means New Zealand's total number of confirmed cases remains at 1,153, and our combined total of confirmed and probable cases remains at 1,503. Today there is an increase of 5 in the number of people who have recovered from COVID-19, so that is 96% of all confirmed and probable cases. I'm pleased to say there are no additional deaths to report, and we have just one person in hospital in Middlemore Hospital, and that person does not require ICU care. Yesterday, our laboratories processed a total of 4,882 tests, and our grand total now is 238,725 tests processed. I'd like to talk a little bit about the new app, NZ COVID Tracer. So, as you all know, formally launched today, was actually available on the Apple and Google stores from last night, and continues to be able to be downloaded from there. It's something like a digital diary that people can use by scanning QR codes at locations that they visit, and those QR codes are based on the nationally used New Zealand business number. And just so people know what a QR code looks like, I have one here. That is a QR, or quick response code. Many people will be familiar with them, but in case you're not, that's a QR code. This is not so if you've photographed it, that is not a real QR code. It won't take you anywhere or let you know that you have been here today. So I would encourage Kiwis to download the app, and our key public health controls, as you know, are to identify cases early by testing, then isolate those people, and then to identify quickly who their close contacts are and isolate and test those people as well. So the app is another tool in our toolbox to help us do that. And the faster we can do that, the more likely we are to contain and prevent any onward spread. If you've been using this new app and we need to trace your contacts, then you can agree if that information is made available to our team. The only information that's held at the Ministry, and that is only for the purposes of this public health contact tracing response, not for enforcement. So the only information that's held is that contact information that you provide when you register. Other information, including the record of where you have been through scanning the QR codes, is only stored on the phone, and it is deleted after 31 days. It is up to you to share that information with the contact tracing team should you be identified as a close contact. So if you do choose to release your information, of course, what that does is help build a picture of where you have been and therefore identify other people who may be close contacts of a case. There's been a lot of interest in the app already. I'm pleased to say over 92,000 people have already registered on the app. The Ministry of Business, Innovation and Employment is in the process of contacting some 800,000 businesses around New Zealand to let them know about the process for generating a QR code that is unique to their business number, and already 1,000 businesses have created the posters, and they are getting new registrations at around 10 per minute. Just to point out that at this point, the app does not replace, but rather complements other actions that businesses are taking to record who has been on the premises. Subsequent releases of the app will have functionality that will allow people to not only be registered, but if there is a case notified, for a message to be pushed out to people who may have been in a particular business at a point in time when they may therefore be a close contact. There have, I understand, been a few wrinkles with the downloads and running the app this morning. Largely, I think, on some Android phones, those are all being looked at. If you have any issues, let us know. The first update or ironing out any of the bugs will be released this afternoon. And we're also talking with those who have developed similar apps, like one being used locally here in Wellington, Ripple, to make sure that there can be connection between this app and theirs, and we will be working closely with them. So moving on to the World Health Assembly, which finished very early this morning New Zealand time. I think you'll all be aware there was a resolution agreed by all member states around the global response to the COVID-19 pandemic, One of the features of that has been of great interest is the agreement for an independent evaluation of the response, including the response by the World Health Organisation and also by member states. For our part, we will of course be willing participants in any review. We're also particularly interested in the many other aspects of that resolution that were agreed, for example, around vaccines and supply chain, and we'd see an important role for us is not only to support international efforts, but particularly to work with our Pacific countries, Pacific Island countries and territories, to ensure that they have ready access to vaccine should one be developed, and of course that their supply chains for medicines and other essential equipment are strong throughout the response.
Today I want to provide you an update on progress towards our goal of stamping out COVID-19 and moving as fast but also as safely as possible and opening up more of our economy and getting New Zealand moving. Visiting Rotorua yesterday and getting out and about on the weekend, it was great to see New Zealanders returning to our new, safer normal. Cafes were full, I can confirm from multiple experiences, and you can see people also adjusting to rules around social distancing, contact tracing and so on. Last week's budget highlighted our commitment to job creation, keeping people in work and supporting key sectors such as tourism to get back on their feet. And ultimately, the best thing we can do for the economy is to stay on top of the virus and continue our managed de-escalation of restrictions when the health data says it's safe to do so. We do intend to keep phasing in additional activity under Level 2 when the evidence show we can, with low to little risk of further outbreaks. As I've previously said, though, descent can be more dangerous than the climb. Many countries that have started to reduce their restrictions have experienced a spike in cases. We shouldn't be so bold as to assume that that couldn't or wouldn't happen here. Remember, COVID-19 is still in our community, and we know from our clusters that one case can become 90 after a single night out or a single event. It would only take 2 to 3 instances of that for our caseload to escalate back to pre-lockdown numbers. No one wants to see that. And so, we have entered levels 3 and 2 with a degree of caution, and the data so far suggests that this has been the right approach. First, the number of new cases of COVID-19 has reduced significantly. There were 31 new cases during the 16 days we were in Level 3, and so far there have only been 2 new cases in the 7 days we have been in Level 2. Importantly, all of the cases under both Level 3 and Level 2 have been directly traced to existing cases and ultimately represent the long tail of COVID. The last case of community transmission, where the source of the case was unknown, was early April. That means we've had 3 full transmission cycles with no new cases of community transmission recorded in New Zealand. We have not seen any new clusters emerge for more than a month. This gives us a high degree of certainty that there is no community transmission in New Zealand. But our journey is far from over. COVID-19 is still present in New Zealand. And it is certainly still present around the world. And while that remains the case, there will be work to be done and there will be risk that needs to be managed. Today, I just want to set out a little more detail some of what the ongoing management of that risk looks like here in New Zealand. Through every level, we will maintain our underlying wall of defence against the virus. Now, that includes widespread surveillance and testing, rapid contact tracing, physical distancing as a new normal, staying home if even mildly sick, regular hand washing, and tight measures at the border to stop new cases coming in. That's our new normal. While our border measures carry on regardless of what level we are at, let me be clear that amendments to the border rules can occur at any level also. So it is possible to have a trans-Tasman bubble, for instance, at Level 2. It is not contingent on us being at Level 1 for that to happen. The spike in new cases in other countries have experienced in recent weeks as they de-escalate their restrictions relate to the very activities that evidence shows us are more likely to spread the virus, mixing and mingling at social occasions. This is the activity that by far and away most concerns us and that we are purposely placing limits on. So tomorrow we take a cautious step forward with bars and clubs being able to open, but with strict level 2 restrictions around being seated and being separated in place in order to ensure that we stay safe. However, I know many people want to return to normal as soon and as safely as we can. And of course, that's everyone's intention. So as we progress through level 2, we plan to regularly adjust our settings to allow more activity when the data says it's safe. The first settings check-in will come on Monday, when Cabinet will consider increasing the size of gatherings. Currently, this sits at 10. If the data leading up to Monday continues its positive run, we will have more confidence to lift the size of gatherings. And very importantly, that does apply to things like church services. As we move through level 2 and continue to have better data on which to make further decisions, that will include the opportunity to further increase the size of gatherings again. We will also have the option down the track of potentially relaxing certain physical distancing restrictions, such as on buses and on planes. Many of you will know that at the moment physical distancing requirements means that they are running under full capacity, I believe for planes at 50%. So there is the option of looking down the track at reducing some of those requirements, potentially even while we are still in level 2, if that's what the data supports. It's important that we get New Zealand moving as fast as we can to limit the economic impact of the virus, which is why we will adopt this nimble approach and take incremental adjustments as and when the evidence tells us it's safe to do so. We do not have to move a full level in order to wind down restrictions, which is something you'll recall I indicated when we set out the framework for level 2. In the same way we broke the chain of transmission by staying a full 5 weeks in lockdown and then assessed our progress by briefly going into level 3, I envisage that we will stay in level 2 until the Director General has confidence that we can de-escalate further. But do keep in mind, you will keep seeing these incremental changes while we were here, and that we will be regularly reviewing those every 2 weeks. But unlike in level 4, as I've said, where the rules stayed the same, we have that flexibility, and that's because our hard-won achievement in getting the virus under control now gives us greater choices and flexibility. We are doing well. Our plan is working, and as a result of our team's hard work, we have scope to get our economy moving again, and in doing so, not only avoid the worst of the health outcomes others have experienced, we can also try to minimise some of the economic pain. All through our response, we've made decisions based on what is best for New Zealand and followed our own plan and our own path, and we do that again. We are hopeful this phased de-escalation will continue our success to date, while avoiding the surge in cases other countries have experienced as they moved out of lockdown. Time will tell, but at this stage we remain cautiously optimistic.